Motion to call on Senator Marc MacSharry. You have 6 minutes.
Thanks very much, Cathaoirleach, and I'm happy to second the motion. I'm glad to have the opportunity yet again, Minister. Indeed, I recall when I had my first opportunity here when you were in the House, and I said how much I admired the straight-talking nature of your and wished you well of your approach, and wished you well, and expressed confidence that if anybody could do it, you could do it. And I think you heckled back, well, you might be saying that in a few months' time or something of that nature. And indeed, here we are. Can I say, at some stage, and I think that you'll note that there's a statement out from my colleague, Deputy Kelleher in the other House today, saying, will somebody tell the Minister that he's the Minister for Health. Oh, you want to check the record now? You can go back. The reality is the entire health service is underfunded. I'm not saying it's perfectly well managed. Clearly there are management challenges and there are things that have to be done. But it's beyond the point of crisis. And I don't envy your position, Minister. I know it's difficult to come up with the adequate solutions. But what needs to be eliminated from the whole process, and granted, you're noted for your straight talk, but we also need action. And we need funds to deal with that position. I mean, we have had the kind of overcrowding that we've had in the run into Christmas and then quite consistently more recently is all a situation that was predicted. I mean, at the beginning of the preparations for, I think, the service plan, Tony O'Brien outlined the concerns and the risks to effectively safety and being able to carry out the necessary services safely without an additional in the region of 1.3 billion. Now, the government's reaction to that, and we all are aware that that there's only so much pie to go around, but notwithstanding that, we gave something in the region of an extra 100 million or thereabouts, instead of the 1.3 billion that was being sought. We all have the anecdotal reality around the country from various hospitals where people have been left on trolleys, elderly people have been untended and so on, and this is unacceptable. I have publicly told people, you know, don't go to hospital unless you're able to go in with them, if the patient is over a particular age. Because in fairness to the nursing staff, in fairness to the orderlies and the various other staff at the hospitals, I mean, they're to the pin of their collar, trying to carry out their duties, and can't give the kind of time that's required to people, because we've shaved down and cut cost so much. And the reality is, as the figures that have been outlined by my colleague clearly point out, we have a situation that's at breaking point. Now, Dr. O'Connell left the health service less than a month ago, just after 8 months, in one of the most senior roles in the HSE. At one time, he wrote his 3-pager analysis that there were 703 delayed discharge patients, taking up 30 wards of capacity. Now, we clearly have an issue there. So why can't these people go home? Is there no nursing home beds or convalescence beds for them? I mean, are we thinking outside the box at all? Have you sat down with Minister Burton, for example, and said, look, should we look at abolishing the means tests on the carers allowance, for example? Should we explore the possibilities of that? Do people have aunts, brothers, sisters, children, who are in a position maybe, with that kind of support being made available to them, to take to them and look after them at home? And perhaps with some other supports, medical card, or the other type of backup supports that we could get it. I mean, it may be more cost effective. I mean, it's 900, 1,000 a week, whatever it is, to keep people in nursing home beds and so on. I mean, has it been looked at? Has a costing been done? Because if it hasn't, that's the kind of outside the box thinking we need to be looking at. I don't know whether it'll work or not, but I know one thing, it's certainly worthy of looking at it. As I said, the abolish of the means test, and look, that with other supports, could give some sort of a solution to the fair deal hold up. We have a waiting list of some 2,000 or thereabouts, and perhaps free up some of this 30 wards of capacity, where at one time people, 703 of them, were waiting to be placed. Indeed, he goes on, Mr. O'Connell, in other material that I've read, that's credited to him, which says that there are a number of patients that have been in hospital waiting for a placement for up to 3 years, effectively living in hospitals. And that's not the kind of management that we need. But I do sympathise with the issue with resources for you. You're sent out there with a statement laundered through some public relations industry, which isn't, I'm sure, where you like to be in terms of, calling it as it is, to say, look, everything is rosy. The special delivery unit is doing their job. We're making progress. It's a difficult task. I mean, it's way beyond a difficult task. I mean, Fergal Hickey, the head of emergency medicine throughout the country, in terms of the representative organisation for the consultants and A&Es, has said, they've warned against the risks that there is, and we don't seem any nearer to a solution. And I think, Minister, what really is needed from you, outline some, I'm thinking outside the box, here's what we're going to do, rather than this is challenging, rather than this is unacceptable. I mean, we're all sick of that rhetoric. I'm sick of saying it myself. But there's one suggestion for you. Come back to me the next day and tell me why it's not workable to abolish the means test and the carers allowance on a trial period to try and free up some space in nursing homes, to try and free up some acute beds in hospitals, and see if it is actually practical. So don't let it be said that I'm not trying to make some sort of suggestions. Now, while it's slightly off the motion at hand here today, I did predict when you went in there that it wouldn't take long, thanks very much, that wouldn't take long before the parrot-like responses that your predecessor, and indeed Mary Harney when she was Minister, wheeled out regularly, saying under the 2004 Health Act, the CEO of the HSE is now responsible for that area, and I have written to him like Pontius Pilate and asked him to respond to you directly. Now, that kind of stuff is unacceptable. Again, I'm sure you don't like doing it. I brought up very specifically some medical card cases, where with all the debacle we had of recent years, I want to read very quickly 3 cases. 1. X and Y, both twins, aged 3, born prematurely, and their lives to date have revolved around medical appointments. X has cerebral palsy since birth and has numerous other health issues as a result. Y has recently been diagnosed with asthma, which will require increased doctor specialist visits to medical in the future. Both boys qualify for domiciliary care allowance from the Department of Social Welfare, and medical reports provided in order to qualify that. Clearly, our departments don't talk to each other because that case is under appeal through my office. We have another one, 18 months, Down syndrome, has medical complications, senior consultant in Crumlin, who can't believe she doesn't have the medical card, again under appeal through my office. These are all in South County Sligo, by the way. Another child, 2 years old, serious medical problems, awaiting a call to Crumlin Hospital, only qualifies for a GP card. Very finally, because we might not have many speakers tonight. This specific case is to do with a man. He has cancer in 2 places and heart conditions. I've wrote to your office specifically about him. I'm not going to name him on the house, but he's from Cartron in Sligo. I'm sure somebody in your office can look up that. We can't continue with the level of autopilot that I'll quite openly say ran this country into the ground in so many ways. So, Minister, don't let autopilot rule your tenure in the Ministry for Health. We know how challenging it is. You don't need to tell us. We're hearing it every day. Tell us the tangibles you're going to do to make it different this time.
Senator MacSharry, thank you. Colin